Introduction to the class. The Galactic Medical Academy buzzed with an unusual energy as students from various alien species gathered for an extraordinary lecture. The amphitheater-like hall, adorned with holographic displays and advanced learning tools, was filled with an eclectic mix of beings, each with unique features, colors, and cultures. Some students had iridescent skin that shimmered under the artificial lights, while others possessed multiple limbs or eyes that reflected their surroundings in vibrant hues. At the front of the hall stood Professor Elix, a renowned figure in intergalactic medicine. His multifaceted eyes scanned the room, taking in the eager faces before him. Today's topic was particularly intriguing: a deep dive into the biology of humans from a distant planet known as Earth. "Welcome, students," Elix began, his voice resonating through the hall. "Today, we embark on a journey to understand one of the most enigmatic species in our galaxy, humans." As he spoke, a holographic image flickered to life behind him, displaying a vivid representation of Earth, its lush forests, sprawling cities, and vast oceans. Humans are classified as Class 12b beings from a planet characterized by extreme conditions and diverse ecosystems. Elix continued. Their biology has evolved uniquely to adapt to such challenges. The students exchanged whispers, their curiosity piqued. They had heard tales of humans, creatures capable of extraordinary feats, yet burdened by vulnerabilities that seemed foreign to many alien species. Elix raised his hand to quiet them, his expression serious yet inviting. "Let us begin by exploring one remarkable aspect of their anatomy. Their autonomic nervous system," he said, gesturing toward a bright-eyed student named Ulra, a young clean with green skin and large inquisitive eyes. "Ulra, could you explain how your species' nervous system operates?" Ulra stood up confidently. "In our physiology," she explained, "the main brain sends signals directly to our limbs and organs, allowing us to control every function consciously. For instance, when we pick up an object, we think through each muscle movement required." Elix nodded appreciatively. "Now imagine if you didn't have to consciously control these actions at all," he said thoughtfully. "That's precisely how humans operate many bodily functions automatically." A murmur rippled through the audience as they processed this new information. Elix took a moment to let it sink in before continuing. "Humans possess an autonomic nervous system that allows their bodies to perform essential functions without conscious thought," he elaborated. "This adaptation is vital for survival on their harsh planet." He pointed to another holographic display that showcased a human heart beating rhythmically. "Take this heart as an example," he said. "It is a smooth muscle that operates independently from conscious control. When a human begins running, their heart rate adjusts automatically without them needing to think about it." Gasps of astonishment filled the room as students absorbed this revelation about human physiology. Elix continued, "However, there is a downside to this remarkable adaptation. Because humans often cannot feel injuries immediately due to their body's prioritization of survival over long-term health, they may worsen their conditions unknowingly." A Zorian student named Nex raised an appendage in curiosity. "If their systems are so autonomous," he asked, "how do they manage medical care?" Elix's eyes sparkled with pride at this insightful question. "Humans have developed advanced medical technologies designed to monitor and treat their bodies externally," he explained. "They rely heavily on diagnostics and tools to understand their internal conditions." To illustrate his point, Elix tapped his tablet, changing the display to show a video of a human soldier treating their own shattered leg on a battlefield. The footage depicted the soldier splinting their injury despite excruciating pain, a testament not only to human resilience, but also to their unique physiological traits. This ability to endure pain while remaining functional is both commendable and cautionary, Elix remarked as he observed his students' reactions closely. The room fell silent as they watched in awe. Understanding humans required an open mind. Their biology was as fascinating as it was complex. As future medical professionals, Elix concluded with warmth in his voice, You must prepare yourselves to adapt your knowledge and techniques to meet these unique needs. As the bell rang signaling the end of this first part of the lecture, students filed out of the hall with minds buzzing with newfound curiosity and respect for Earth's inhabitants. They were eager for what lay ahead, an exploration into the depths of human anatomy that promised more surprises than they could imagine. The following day brought renewed excitement as students returned for another session with Professor Elix. They were ready to dive deeper into understanding human resilience and adaptability, a journey that would challenge their perspectives on biology and medicine forevermore. With anticipation hanging thick in the air like static electricity before a storm, they settled into their seats once more, ready for another chapter in unraveling the mysteries surrounding humanity's intricate existence. Understanding human physiology. The lecture hall hummed with excitement as Professor Elix prepared to delve deeper into the intricacies of human biology. The students, still buzzing from their previous discussions, settled into their seats, eager to uncover more about the resilience and adaptability of humans. "Welcome back, students," Elix greeted warmly. "Today, we will explore the remarkable physiological traits that enable humans to endure extreme conditions and recover from injuries that would incapacitate many other species." As he spoke, a holographic display illuminated behind him, showcasing a series of images depicting humans in various challenging environments: arid deserts, icy tundras, and bustling urban landscapes. Humans are not only survivors but also thrivers in some of the harshest conditions imaginable, he continued. "Let's begin by examining their incredible ability to recover from trauma." The display shifted to show a human athlete, a sprinter, who had suffered a severe injury during a race. The video captured the moment of impact, followed by the athlete's determination to continue despite visible pain. "This is an example of human resilience," Elix explained. "Their bodies have evolved mechanisms that allow them to withstand and recover from injuries that would be fatal or debilitating for many other species." A student named Rin, a tall Zorhian with shimmering blue skin and keen eyes, raised an appendage. "Professor, how do humans manage to push through such pain? Is it purely physical?" Elix nodded appreciatively at the question. "That's an excellent point, Rin. While physical resilience plays a significant role, psychological factors are equally important. Humans possess a unique combination of mental fortitude and physiological adaptations that contribute to their ability to endure pain." He activated another segment of the display, showcasing brain scans of humans experiencing pain versus those who had learned coping strategies like mindfulness and visualization techniques. These scans reveal that when humans employ mental strategies to manage pain, their brains exhibit different patterns of activity compared to when they do not, Elix explained. The students watched intently as Elix continued. "This interplay between mind and body is vital in understanding human physiology. Their autonomic nervous system allows for automatic responses to stressors. This includes both physical injuries and emotional challenges." The display shifted again, this time illustrating the human autonomic nervous system's two main components, the sympathetic and parasympathetic systems. The sympathetic system activates during stressful situations, often referred to as the fight or flight response, while the parasympathetic system helps restore balance afterward, Elix elaborated. A petite student named Lara raised her hand. "So, when humans are injured, their bodies can react automatically without conscious thought." "Exactly," Elix affirmed. "For instance, if a human experiences a cut or bruise, their body will initiate healing processes automatically. Blood vessels constrict to minimize blood loss, and immune responses kick in without any conscious effort from the individual." As he spoke, the display transitioned to show images of various healing processes in action: clotting blood cells forming scabs, white blood cells attacking pathogens, and skin regenerating over time. This remarkable ability to heal is partly due to their advanced medical technologies, Elix noted. He paused for a moment before continuing. "Humans have developed an extensive array of medical practices that complement their natural healing abilities. For instance, surgical procedures can repair damage that might otherwise be beyond natural recovery. The students were captivated as Elix showcased videos of intricate surgeries, heart transplants, and orthopedic repairs, demonstrating how human ingenuity has allowed them to overcome even the most severe injuries through medical intervention. Let's discuss one specific case study Elix suggested as he prepared to share an inspiring story. The display shifted once more to show images of a young human named Alex who had survived a catastrophic motorcycle accident. Alex was involved in an accident that resulted in multiple fractures and severe internal injuries. Elix narrated as images depicted Alex being treated in a hospital setting. Despite the gravity of his situation, Alex demonstrated extraordinary resilience throughout his recovery process. The video showed Alex undergoing surgery followed by physical therapy sessions where he worked diligently to regain strength and mobility. What's remarkable about Alex's story is not just his physical recovery, but also his mental determination, Elix emphasized. A student named Jax, a robust Braven with deep-set eyes, interjected with curiosity. Was Alex's recovery typical for humans? How do they generally cope with such traumatic experiences? Elix smiled at Jax's insightful question. Human recovery varies significantly based on individual circumstances. However, many rely on social support systems, friends and family, to aid in their healing process. He displayed images of Alex surrounded by loved ones during his rehabilitation journey. This sense of community provides emotional support that is crucial for coping with trauma, Elix explained. Moreover, he added thoughtfully, humans often utilize various coping mechanisms, such as journaling or engaging in creative outlets like art or music during their recovery periods. The students absorbed this information eagerly. They were beginning to appreciate not only the physiological aspects, but also the emotional dimensions of human resilience. Elix then shifted focus back to physiological traits by discussing pain tolerance further. He displayed data comparing pain thresholds across different species, showing how humans can endure significant pain levels while still functioning effectively. However, he cautioned, this ability can sometimes lead humans into dangerous situations where they may ignore critical injuries due to their high pain tolerance. Next raised his appendage again. So how do they know when it's time to seek help, if they can't feel injuries right away? That's an excellent question. Elix replied enthusiastically. Humans develop an acute awareness over time. They learn patterns associated with injuries and symptoms through experience. He displayed another video showing a human athlete who had ignored early signs of injury while training but eventually sought medical help after realizing something was seriously wrong. Humans often rely on external diagnostics too, like imaging technologies, to identify hidden issues within their bodies, Elix explained as he highlighted various diagnostic tools used in human medicine. As the lecture progressed into discussions about specific medical technologies utilized by humans, including MRIs and CT scans, the students remained engaged and inquisitive. Understanding these tools is essential for future medical professionals working with human patients, Elix concluded as he wrapped up this segment of the lecture. The bell rang, signaling the end of class once more. Students filed out with minds racing, full of new insights about human physiology. Their resilience was not merely biological, but intertwined deeply with psychological aspects as well. As they left the hall filled with anticipation for what lay ahead in their exploration of humanity's complexities, the journey into understanding these extraordinary beings continued promisingly onward into uncharted territories yet unexplored. Human medical practices. The atmosphere in the lecture hall was charged with anticipation as Professor Elix prepared to guide his students through the intricate world of human medical practices. The previous sessions had laid a solid foundation, exploring human physiology and psychological resilience. Today, they would focus on how these elements converged in the realm of medicine. Welcome back, students, Elix began, his voice resonating with enthusiasm. Today, we will explore the fascinating ways humans have developed their medical practices to address their unique physiological and psychological needs. As he spoke, the holographic display flickered to life, showcasing a timeline of human medical advancements, from ancient herbal remedies to cutting-edge surgical techniques. Humans have a rich history of medical innovation, Elix continued. Their journey has been shaped by necessity, curiosity, and a relentless pursuit of knowledge. He pointed to a student named Zim, a broad-shouldered Braven with deep-set eyes. Zim, can you summarize what we've learned about human resilience and adaptability so far? Zim stood confidently. We've learned that humans possess remarkable physiological traits that allow them to endure pain and recover from injuries. They also rely on psychological resilience and social support systems to cope with trauma. Excellent summary, Elix replied, nodding appreciatively. Now let's delve into how these traits manifest in their medical practices. The display shifted to show images of ancient human healers using natural remedies, herbs, roots, and minerals to treat ailments. In ancient times, humans relied heavily on their understanding of nature for healing, Elix explained. They observed the effects of various plants and developed remedies based on trial and error. He then transitioned to images of early surgical practices, highlighting the evolution from rudimentary techniques to more sophisticated methods. Surgery has been a critical aspect of human medicine for centuries, Elix noted. Despite their initial limitations, humans have made significant strides in surgical techniques. A Petit Syrian student named Far raised her hand. Professor, how did they transition from those early methods to more advanced surgical practices? Great question, Far, Elix replied. The advancement of surgical techniques is largely attributed to the development of anesthesia and antiseptic practices in the 19th century. He displayed a video showing a historical reenactment of an early surgery performed without anesthesia, an excruciating experience for the patient. Before anesthesia, surgeries were often brutal and traumatic, Elix explained. The introduction of anesthetics allowed humans to perform complex procedures without causing unbearable pain. The students watched intently as the video transitioned to modern surgical practices where patients were comfortably sedated. Today's surgeries are precise and often minimally invasive, Elix continued. Techniques like laparoscopic surgery allow for smaller incisions and quicker recovery times. He switched gears to discuss another critical aspect of human medicine: diagnostics. The display now showcased various diagnostic tools used by humans: X-rays, MRIs, and blood tests. Humans have developed an array of diagnostic technologies that enable them to identify health issues accurately, Elix explained. Take MRI technology, for instance, he said as he highlighted an image of an MRI machine in action. This non-invasive technique provides detailed images of internal structures without requiring surgery. Next, the Zorian student from previous lectures raised an appendage again. How do humans ensure accuracy in their diagnostics? Elix smiled at Nex's curiosity. Humans rely on extensive training and education in medical fields to interpret diagnostic results accurately. They also engage in continuous learning through research and clinical practice. He displayed graphs showing advancements in diagnostic accuracy over time, a testament to human innovation in medicine. Now let's explore a case study that illustrates these practices in action, Elix suggested as he prepared to share a compelling story. The display shifted to show images of a young woman named Maria who had been diagnosed with a rare condition affecting her heart function. Maria's journey began when she experienced unusual symptoms: fatigue and shortness of breath, Elix narrated. She initially dismissed these signs, but eventually sought medical help after her condition worsened. The display showed Maria undergoing various diagnostic tests, blood work, echocardiograms, leading to her diagnosis. Thanks to advanced diagnostic tools, Elix continued, doctors were able to identify the underlying issue: a congenital heart defect that required surgical intervention. The students watched as the video depicted Maria undergoing heart surgery, a complex procedure involving skilled surgeons working with precision. What's remarkable about Maria's story is not just the surgery itself, but also her recovery process. Elix emphasized as the video transitioned to show Maria engaging in physical therapy post-surgery. Her determination and resilience were crucial during her rehabilitation. He noted, Maria utilized both physical therapy techniques and psychological strategies, like visualization, to aid her recovery. A student named Jara raised her hand thoughtfully. So humans use both physical and mental strategies during recovery. Exactly. Elix affirmed enthusiastically. This holistic approach is essential for effective healing. He then shifted focus toward preventive care, another vital aspect of human medicine. The display showed images depicting routine checkups and vaccinations designed to prevent diseases before they occur. Preventive care is crucial for maintaining health, Elix explained. Humans understand that early detection can lead to better outcomes. Farr interjected with curiosity. How do cultural beliefs influence their approach to health? Elix nodded appreciatively at Farr's question. Cultural beliefs play a significant role in shaping health behaviors among humans. He displayed images illustrating various cultural practices related to health, from traditional healing rituals to modern wellness trends. This diversity reflects how humans adapt their medical practices based on their cultural contexts, he added. As class continued, Elix emphasized the importance of empathy in medical practice, a quality that enhances patient care significantly. Empathy allows healthcare providers to connect with patients on a deeper level, he explained while showing videos depicting compassionate interactions between doctors and patients. The students absorbed this information eagerly. They were beginning to grasp not only the technical aspects, but also the emotional dimensions involved in human healthcare. As the bell rang signaling the end of class once more, students filed out with minds racing full of new insights about human medical practices. Their resilience intertwined with advanced technologies created a fascinating tapestry that was both complex and inspiring. Outside the lecture hall, discussions erupted among students about what they had learned, each eager voice contributing thoughts on how these insights could shape their future roles as medical professionals. They realized that understanding humans was not merely an academic exercise. It was an exploration into the very fabric of what it means to be alive. A journey that promised even more revelations as they continued their studies together under Professor Elix's guidance.